Alicia. How are you today?
Good. How have you been?
Pretty good. How about yourself?
Good, good.
Do you mind if I take a seat and we can chat for a bit?
No, go right ahead.
Alright. So, it's been about a month since I've seen you last. Tell me about how things have been going.
They've been going pretty good. I'm living at my friend's, like we had discussed whenever I was in hospital. And it's been going good. Like, I've been clean ever since. And right now I'm just kind of like at a point where I'm trying to decide if I want to, like, there's a rehab program that I could go into, but I'll be sent away. So I'm kind of like thinking about if that's what I want to do, or if I want to stay like where I'm at now in the program, the house that I'm living in, like with my friends, like we're all on a program for like clean living. So like it's been going good, but I'm not sure if I should go to the other program, and if like getting away from like my usual stuff would be like a good idea maybe. I don't know.
Okay, so it sounds to me as if you're unsure about the path that you're on and the plan that you have going.
Yeah, kind of. I'm not sure if I want to like stay with what I've started, I guess, or if I should switch programs.
Okay, so just to clarify, you still want to continue getting clean?
Yeah.
Okay, so we're still good on that track. And how's that experience been going so far?
It's alright. Like, to be honest, it sucks. But, I don't know, it's what I want to do, and, like, I know that it's what I have to do in order to get to where I want to be. So, it's tough right now, and that's kind of why I'm thinking of, like, going to the other program, because I find that being in the house where I'm at now, I'm around the same people from my old lifestyle, so it just, like, reminds me of it every day. And I feel like maybe if I went to the other program, it would be like a completely new start. So, yeah, that's how that's been.
So, it seems like you enjoy where you're staying and it's working for you right now. But, and because you guys are all on the same program, but that just having those people and those settings around you kind of triggers the memory of when you used to use drugs?
Yeah, well, it's like all of their old friends are still around and they're not on the program. And if any of our friends in the house decides to not be on the program, then that would kind of change, like, dynamics at home. I don't know, I think I'm ready for, like, a new, like, start completely. We haven't been getting along well, like, in the house that much, which is probably to be expected if everyone's starting to be sober. But, so, I don't know, I just think maybe I'd have better resources and stuff if I went to the other program.
Okay, so how about we talk about some of the benefits and the limitations even of going to this other program?
Okay, yeah, I think that would probably help me, like, see my two different options clearer. So the benefits would be that I'm, like, away from all, like, the people that used to bring drugs into my life, because, like, there's some people that are done with that, but there's some people in my life that aren't. And I would be, like, in a completely, like, drug-free environment, so it wouldn't even be, like, a thought or a temptation. So it would probably, like, it might be easier to, like, get past that temptation phase in a place that has very minimal temptations. Because I'm not interested in relapsing, so that's really something I want to avoid. But the limitations would be that I would be away from my friends that are trying to get clean. So I would lose that support system.
Okay, so by the sounds of it, you definitely have the right motivation to keep you going in any sort of program. So the benefits would be that you would be away from a lot of the noticeable triggers in your life, and that you would be in a drug-free environment, so you wouldn't come face to face with the temptation. But the limitations are that you would be leaving your current support systems.
Yeah.
Okay. So you would definitely form new support systems at the rehab center. But I know that it is also difficult to leave behind past support systems. Where is this rehab center located? Is it somewhere that your friends could visit you once you gained visitation rights?
It's 2 hours from here, so maybe, they maybe could, maybe every second week, or if they all came up, they could probably make that work. But
would that be something that you'd be interested in?
Yeah, I would really like it if they came to visit me. I haven't really talked to I'm not sure if you're allowed to have visitors, or if I'd have to get them, pre-approved and stuff. But that's something, I'd definitely be interested in looking into. I think that would work for us, and it would help pass the time.
Yes. Okay, so what about the benefits of staying where you are?
Basically the benefit is that I wouldn't lose my old friends, and I'm already set up in that program. Which might, I don't know, I guess the more that we're thinking through it, it kind of sounds a little lazy. Because I think that other program, it does sound better, and the only real benefit to staying is that I don't have to leave.
Okay. I think some other benefits of that program is that, your friends are going through it as well, but like you mentioned, there is a risk that one of your friends will relapse while you're around, and one of your roommates could relapse, and that would be very, very difficult for you and your other roommates who are trying to get clean as well.
Yeah.
So I do think there is some importance to getting away from that risk.
Yeah, I'm actually really scared that one of them in the house is gonna relapse and then start bringing stuff around, and then it'll just be a domino effect.
Now you mentioned that some of your roommates' friends still use drugs.
Yeah.
Are they allowed to bring that in the house, or is there rules against that?
Not really supposed to, but it happens, I guess.
Okay. And that can't be easy for you.
No, it's not, and you don't feel like having that stuff around, but you don't want to make a big deal out of it all the time, I guess. It's kind of an awkward situation. I don't know.
That can be very difficult, having that type of tension in your in your home, when that's kind of your place that could be your solitude
Yeah.
is your home, and it's very difficult when there's tension there.
Yeah, it's hard to like stay away from it when it's in your living room. Yeah, I think that it really would maybe be the best fit for me to go like at least try the new program. If I find it's too difficult, like being away from like my old support systems, then that would be something I could look at then. But I could at least like try it and see if it could offer more benefits than what I'm getting now.
Okay. Well, that sounds like it would really be an option for you. Do you have any way of getting a hold of the program?
I do. I have some pamphlets at home that they had given me, and I guess what I need to do now is just call them and see if I would be able to have visitors. Because I think that would be the deciding factor for me, if I was able to have my friends visit me. And then,
because it's still important to have outside supports.
Yeah, I don't want to have to like give that up. But yeah, I do have a way to contact them, and I think that's what I'm going to start planning towards now and thinking about that.
Yeah, because it's very important once you're done the program to have those supports to come back to. So it's not something that you want to get rid of.
Yeah, I don't want to cut off like the ones. There's certain ones that I'd like to keep and have been there for me through like tough times. And I want to still be like able to contact them while they're trying to get clean too.
Yeah, that would be nice.
Thank you so much for talking with me, Trisha. I'm really happy that we've been able to meet up again, and it's been really helpful. You've helped me like see like my two options differently and find which one fits best for me.
Not a problem. And I'll definitely check up with you to see if you're able to get into the program. And if I can do anything to help you transition into that program, I'll do my best.
Perfect. Thank you so much.
Thank you.
Take care.
You too.